Thank you for joining us today for our panel, Countering Policy Exclusions, Canada, Disability and International Commitments. Okay, well, welcome, as I say. I'm Deborah Steenstra, and I'll introduce myself a little bit more fully in a minute, but I wanted to go through a couple of housekeeping tasks to make sure everyone can enjoy this and access this event in the way that they need to. Please note that we're recording this event so that we can make it available to those who are not able to attend. We have a human captioner, and they will provide live, accurate captions. We suggest you do not turn on captions in Zoom, nor click on the Otter AI link. Instead, please use the link provided in the chat to access CART live captioning. Because typing in the chat can interfere with screen readers, we ask that you not post in the chat until you're invited to do so. We will have a time for question and answer and engagement at the end of the session. And at that time, you can post in the chat and also use the raise hand feature to ask a question. If you're having a technical issue, please type a private chat to Jordan Craig from the drop-down list of names in the chat. Next slide, please. As I said, my name is Deborah Steenstra. I use she, her pronouns, and I'm honored to host today's conversation. I hold the Jaroslawski Chair in Families and Work, and I'm the director of the Live, Work, Well Research Center at the University of Guelph. I come to this conversation from years of advocacy and researching, bridging international commitments on women's and disability rights with local experiences in Canada. And I often tell the story of both my kids breastfeeding at international conferences in New York or in China. So I do try to build those personal and political links. I also lead an international partnership called Engendering Disability Inclusive Development, Genre, Handicap et Développement Inclusif. We call it EDID-GEDI. We work on rights and justice with and for women and girls with disabilities in Canada, South Africa, Vietnam, and Haiti, as well as transnationally. Please check out our work. The link is on the slide, but it's also in the Word document that was circulated before this meeting and has a link to all the resources. Next slide, please. I'd like to welcome each of you to this gathering from wherever you come from around the world. I'm coming to you from what we now call Guelph in Canada. These are the treaty territories of the Mississaugas of the Credit, First Nation. This territory is steeped in rich Indigenous history and is home to many First Nations, Inuit, and Métis people. We take the time to recognize Indigenous peoples and their relationships with the land as an essential way to begin this conversation. I come as a settler and an immigrant scholar and want to make explicit my commitment and that of the Live, Work, Well Research Center to learn from and with Indigenous people and to persistently insist on countering the effects of colonization, especially for Indigenous women, girls, and gender diverse folks. Next slide. This is the third in a series co-hosted and co-funded by the Live, Work, Well Research Center and Dr. Leah Levesque's Canada Research Chair in Critical Community Engagement and Public Policy. I'd like to acknowledge and thank Leah deeply for her support and her modeling of how to do this work on this event and series. So thank you, Leah. Leah will be helping in the background with timekeeping and with reading your questions in the chat. We're calling this series Countering Policy Exclusions. Each panel reflects on themes emerging from our two intermingled research programs, EDID-GEDI and the Canada Research Chair in Critical Community Engagement and Public Policy. We want to foster dialogue and practice for intersectional solidarities and policymaking with specific attention to the rights and experiences of women, girls, and gender diverse folks with disabilities. Given the ongoing and intertwined global crises related to climate, governance, and many other areas, we recognize that the status quo is not an option and that there's an urgent need for conversations about new ways of understanding and responding to the failures of the state. Centering the knowledge and experience of people most affected and often marginalized by these failures is critical for identifying and responding to them. But this knowledge and experience is often ignored in policy conversations across jurisdictions and policy areas. In today's conversation, we're going to return to a focus on commitments Canada has made in key international agreements related to disability, accessibility, and inclusion. It's an opportune moment at the beginning of a new federal government, cabinet's announced tomorrow, to ask what key priorities have emerged from the work of civil society organizations and others to hold governments accountable to these commitments. Before we get into this conversation, I'd like to give you some context and background. Our panelists will be discussing several international treaty bodies that Canada is a party to, as well as some less formal but still important international gatherings. In almost all cases, the formal commitments and treaties are commitments made by governments in a government-to-government setting. In this context, civil society plays the important role of trying to shape the government's commitments and hold them accountable for implementing these commitments. They may do this by holding what we call side events outside the main stage. Sometimes they're appointed as a member of a government delegation, or they may be primarily involved in lobbying governments informally and networking with others at the meeting. Today, our conversation is based on the extensive experiences of our panelists in these roles. In the United Nations, commitments are primarily made through treaties. When a country ratifies a treaty, they agree to report regularly on its implementation. Civil society organizations can also submit what are called parallel or shadow reports on how they think implementation is going. Implementation is reviewed by an independent expert committee that provides a set of concluding observations. And we'll be talking about two United Nations treaties today. The first is the Convention on the Rights of Persons with Disabilities, or the CRPD. It was adopted by the United Nations in 2006 and ratified by Canada in 2010. As with all member states, Canada must regularly report on its progress in implementing the CRPD. Canada submitted its second and third reports in 2024, and these were reviewed by an expert group in March 2025. Several panelists were in Geneva as observers to that review. Links to the related documents are in the Word document that was circulated with resources. The second United Nations treaty that we're going to talk about today is called the Convention on the Elimination of Discrimination Against Women, or CEDAW. It was adopted by the United Nations in 1979, and Canada ratified it in 1981. Canada submitted its 10th report in 2022, and it was reviewed by the expert committee in October 2024. And again, key documents are in the Word document that we circulated. Commitments can also be made at large global conferences whose final agreements or documents can be guideposts for priority areas for action by governments. In March 2025, the United Nations Commission on the Status of Women hosted the 30th anniversary of the Beijing Declaration and Platform for Action for Women, a key global norm related to women's equality. The Government of Canada submitted its 5th report on the implementation of the Beijing Declaration and Platform for Action in 2024, and Canadian civil society organizations also developed a report on their review of Canada's implementation. And those two documents are listed in the Word document you received. In April 2025, the third Global Development Summit was held in Berlin, co-hosted by Germany and Jordan. Many governments noted their commitments to disability, inclusion, and accessibility, although Canada did not make any new commitments apart from those they had made at the second summit. There was a civil society summit held the day before the official government summit. The Global Disability Summit ended by adopting the Amman Berlin Declaration, which calls for at least 15% of international development programs to pursue disability inclusion as an objective. And a link to the declaration is in the Word document we circulated. The final gathering our panelists will talk about is the G7 Ministers' Meeting on Inclusion and Disability, held in Italy in October 2024. The ministers adopted the Solfagano Charter committing to disability inclusion, and the link is also in your documents. Phew, that's a lot of information, and I get a bit overwhelmed just spewing it all out for you. And there's been, I'm excited to say, a lot of recent international activity around disability and accessibility. With the panelists' discussion, we hope that these often dry commitments will come to life. And with the identification of key priority areas for government work, we can help the federal government with setting its priorities. So let me tell you a little bit more about how today's event will proceed. We're joined by 4 outstanding panelists. Their full bios are listed on the event website, and the link is provided in the Word document. Maureen Hahn is the Chief Executive Officer or CEO of the Canadian Council for Rehabilitation and Work, CCRW. Neil Bélanger is the CEO of Indigenous Disability Canada / British Columbia Aboriginal Network on Disability Society, IDC / BCANS. Marika DePaul is Humanity and Inclusion, or HI Canada's specialist in inclusive governance. And Bonnie Brayton is the CEO of DAWN Canada, the Disabled Women's Network of Canada. We will have 3 parts to our conversation. In the first part, I'll ask each of our panelists to respond to the same question. In the second part, we'll have a question specifically tailored to each panelist. And then we'll post all these questions in the chat. In the third part, we invite you into the conversation in a question and answer section. We hope you can stay for the entire 90 minutes. With that as background and introduction, let me ask the first question to all our panelists, and we'll post that question in the chat. And it's one of these tricky ones because there's more than one question in the one question. Could you give one example of where you've been active at the international level recently and what the implications are of the event results or conclusions for disability rights and justice, especially for women and girls with disabilities in Canada? In this context, what are 1 or 2 policy actions you think the new federal government should undertake to address these conclusions? And how are women and gender diverse people with disabilities providing leadership in this area? So the order of responses are, we'll start with Maureen Hahn, then we'll go to Neil Bélanger, Marika DePaul, and then end with Bonnie Brayton. So Maureen, the question is in the chair, and you've heard it before. May I invite you to start?
Thank you so much. Thank you, Deborah, and thank you very much for inviting me here today. I very much appreciate the opportunity to come and talk to everybody, and to speak specifically about what happened at the G7 meeting in Italy in 2024. So, as we all know, the G7 is a government-to-government discussion, and as Deborah opened in her monologue at the beginning or in her introduction, we at civil society have to figure out how we fit in. Luckily, this past year, the G7 Leaders Summit was held in Italy in June of 2024, and during that summit, the leaders tasked the disability ministers, so the ministers responsible for disability within the G7 countries, to create a charter to support disability in G7 countries. So, and that came out to the Solfagano Charter, and it was agreed to by all parties. So, and this is the first charter that the G7 countries have focused on with disability as a priority. So it's exciting, right? It's exciting, and it's aimed at integrating all of the rights for folks with disabilities across all political agendas and making sure that there's concrete actions to ensure universal access and, of course, accessibility. So there's lots of areas of this charter that are important. It promotes independent living, support for inclusive education, decent employment and decent working conditions, the fostering of inclusion for youth or persons with disabilities in sports, cultural, and recreational activities, as well as overall emergency prevention and disaster risk management. And it's based in the UNCRPD, which I know Neil is going to be speaking to as well, and really advocates for that cultural shift in policymaking to ensure that the disability community is very actively and meaningfully engaged in decision-making processes. So one of the answers to the question that Deborah has posed is, where are a few of the areas that we feel that we can make an impact? And for me, of course, from CCRW, work inclusion is an important focus of the charter, and it positively contributes to the goals of, living independently, fully realizing personal life projects, and that social well-being and quality of life. And we all know that, of course, employment is an effective tool to strengthen empowerment, self-determination for everybody, including folks with disabilities. And so promoting the talents of folks with disabilities is also, and autonomy is also part of the charter. And it specifically calls out that the role of public, private, profit, and not-profit organizations are the three areas that really need to be focusing on what are the tools and resources needed to in order for people to succeed in the workplace through support and appropriate accommodations. So there's a lot of other pieces of the charter, but specifically to girls and women, unfortunately, and gender diverse folks, unfortunately, not a lot is mentioned in this charter. There is a couple of mentions around women and other disadvantaged groups facing severe disadvantages in the labor market, for example. And so promoting decent employment and full enjoyment of labor rights is there. And it makes mention of girls and women, but it doesn't talk about how. It does talk about especially maybe for youth, including girls, to focus on education as well, and making sure that education is is a priority within the charter as well. Now, what happened at the end of our involvement, at the end of CCRW's involvement with the panel, was that we recognized that we didn't really have a benchmark from which to start from around measurements around the G7 countries. And I think that that's a really big opportunity for us coming out of that gathering. And CCRW actually has applied for and has received some funding through Accessibility Standards Canada to do just that, to set the benchmark and to figure out how we can measure movement across the G7 countries for employment in it with an intersectional framework that I'm looking to Dawn to really help us support us in creating that framework. And with that, Leah, I see you, and I have just wrapped up. So yay!
Wonderfully done. Thank you. And thanks for those really interesting points. I've noted some of them. We'll come back to them at the end. Maybe I can turn it over then to Neil Bélanger. Neil,
thanks.
Are you
there? I'm here. Thanks, Deborah. Okay. Can you hear me okay? Great. Thanks, everyone. Good morning, good afternoon. Before I begin, I'd just like to acknowledge the traditional territories that I'm presenting on, those of the Esquimalt and Songhees people. And I'm just going to speak very briefly about our work with the CRPD, but what I'd like to also do is acknowledge a couple of people who have been instrumental in that and that we lost during the last years working on the CRPD. The first is, of course, Stephen Esty, who was a champion for human rights in Canada and instrumental in having Canada ratify the CRPD. And second, Ellen Cohen. Ellen Cohen was a participant with us in Geneva this year, who unfortunately passed away while we were there. She has been an integral part of mental health and advocacy for mental illness in Canada for decades, and a strong part of civil society. And they both will be missed very much by the community. So a little bit about us. So we've been involved in international work regarding disability for a number of years. We, like many of our partners, hold international consultative status with the United Nations Economic and Social Council. We're the only Canadian organization to hold observer status with the European Association of Service Providers for persons with disabilities, and we work closely with the Continuing Committee on Officials on Human Rights and various special rapporteurs as it pertains to disability in Canada. We've been involved with various aspects of the convention, including Canada's first review in 2017, and of course, most recently, as Deborah noted, Canada's second review, which was done in Geneva in March of this year, as well as working with the federal government and other entities on the United Nations Declaration on the Rights of Indigenous Peoples. So we became involved back in 2019, I think it was, where we had the support of 29 national disability organizations, and we were successful in getting a contract from the federal government to work as the Secretariat lead organization, working with civil society to prepare and present in relation to Canada's upcoming review. Unfortunately, as we all know, COVID then struck, and the original shorter contract had to be extended with no additional funding until past the pandemic, about 5 years. But this 5 years gave about 60 civil society organizations the opportunity to work together on developing the initial recommendations for the CRPD committee. And we presented those in 2019, and then work on the coalition's shadow report, including reviewing Canada's response to the list of issues presented by the committees and additional gaps and non-compliance issues identified by each of the members. I think that this year it was pretty significant. I think the committee saw 23 different shadow reports submitted by Canada, so that's quite a few reports. We also met with the committee's task force prior to going to Geneva to talk about some of the higher priority areas that have been identified by civil society. And then approximately, I believe, 15 members of our coalition of the organizations that worked with us on the shadow report attended the session in Geneva over a 2-day period. To be able to present key areas of concerns through an interactive dialogue, meeting with the committee on a whole, and then one-to-one meetings with members of the committee, so that we could, as organizations and a coalition, put forth our priorities and our recommendations, including women and girls with disabilities. The process is always good. It's always very interesting. There have been some changes within with the UN and how documents and the process works. We were hoping for more of an interactive dialogue between the committee and Canada. I think the committee was hoping for that as well. More explanation about why things happen or why things don't happen. But largely, I think from Canada's position, a lot of the answers were boxed, prepared before we even got there, given to the committee as anticipated answers to questions that they knew were coming, which is unfortunate because we thought there would be more interactive dialogue and more opportunity to discuss things, discuss barriers, and how we move forward as Canada and civil society. But despite this, a number of key observations and priority areas were forwarded to Canada by the Committee for Action, including several as it relates to women and girls. And these are very broad, and they're in the report and the documents that have been forwarded. But they identified lack of close consultation and active involvement by marginal groups, persistent discrimination, women and girls are experiencing disproportionate rates of poverty, barrier to housing, lack of financial resources, etc. Limited, this is a very important one, limited representation in political advocacy, leadership positions in public life, lack of culturally appropriate services, lack of disability awareness campaigns to combat ableism and stigma, accessibilities within communities. MAID Track 2 was, look, I'm getting a wave, was predominant through our the recommendations to Canada. And I'll jump through all these lists because you can read the report. And the unfortunate part is today, as we see in the world and we see how funding's changing and different perspectives of governments, and how that impacts the UN, we may not get back to the UN to look at the CRPD or any other convention in a reasonable cycle going to 8 to 12 years, which will be devastating for the disability community and really remove any priority put on governments by the international community. And I'm almost done. So in relation to the policy actions, I have several, I have more than two. So the first one is, of course, repeal Track 2 MAID in its entirety. Revisit the Canada Disability Benefit, make sure that it actually pulls people out of poverty and that the eligibility is changed completely to go to the individual, not family-based. Revamp non-insured health benefits so that to include emergency funding to escape abusive relationships. Mandate political parties to include representation from women with disabilities. And finally, provide civil society with the resources necessary to do the work of monitoring these conventions, not off the side of our desks, but on an ongoing basis. And not only for the CRPD, but for all conventions, because if we are going to lose that frequency of review, it's going to be very important that the disability community is now involved in the other conventions and putting that disability lens on there. And with that, before I get another wave from Leah, thank you.
Wonderful. Thank you so much, Neil. What a rich bunch of ideas and priorities you've put on the table. So thank you. Marika, maybe I can turn over to you from your perspective from the Global Disability Summit.
Of course. Thank you, Deborah. I hope you can hear me well. Yeah, so I would like to talk a bit more about the Global Disability Summit, which took place beginning of April in Berlin. And the Global Disability Summit, or GDS, it's a global framework that really aims to close the gap between disability inclusion and development cooperation. And this year, the summit brought together over 4,700 participants, and it resulted in over 800 new individual commitments to disability inclusion. And as you mentioned already, there was this political declaration that was adopted, and so far has been endorsed by 74 governments. But first, I wanted to talk a little bit about women and girls with disabilities, specifically at the forum. And one panel discussion that HI participated in alongside women leaders with disabilities was on human rights of women and girls with disabilities. And what was striking, that there was really a very strong consensus that today gender and disability are at risk once again of being erased. And this is really why gender needs to be on the agenda in all disability rights spaces and vice versa. So one of the key messages really from that event, and that was brought by women and girls with disabilities, was the need for cross-movement collaboration. And there was a strong emphasis on allyship, and especially that it is not just a word, that it needs to be lived and practiced. And so this is something that I think we can really learn from feminists with disabilities, and where they are already providing this leadership. But then going back to the specific outcomes of this year's Global Disability Summit, as I mentioned, there were all these new commitments, but as Canada at the time was in caretaker mode, the government was not able to make new commitments. So I think a specific policy action that we would like to bring forward is the need to at least take stock of progress made so far in those existing commitments and really make that a conscious effort in close consultation with the disability rights movement in Canada, and to prioritize achieving those existing commitments by the next summit. There was, of course, also the political declaration. And as you already mentioned, Deborah, it echoed this call 15 for the 15, which refers to the need for 15% of humanitarian assistance and development funding to be allocated to mainstreaming inclusion of persons with disabilities. And this is really important because today we can see that disability inclusion is far from being a focus of international development cooperation and humanitarian action. Just wanted to pause for a second to adjust my screen because I couldn't see Leah, so I want to make sure that I stick to the allocated time. But this is really, so because we have now this clear target of 15%, this is really a unique opportunity to go beyond awareness raising and beyond these individual commitments that we have seen so far by bringing about really measurable change through this 15% target. And this shows dedication to disability inclusion, but what was very interesting was that a closer look at the declaration also shows that a strong focus on diversity of people with disabilities was actually missing here as well. And this was rightfully called out by several of the women leaders with disabilities at the forum, including a very powerful statement on the last day by Ruth from Disabled Women in Africa, who said that nothing will change if this 15% is ignoring the diversity of people with disabilities, including women and girls with disabilities. And so Canada has not yet endorsed the declaration because it was in caretaker mode, but I think it's very important for the Canadian government to support the declaration, to strive for the 15%, but also to really reflect on how funding will impact women with disabilities specifically, and for them to take the necessary steps to mainstream both gender and disability with specific attention for the multiple and the compounded barriers that women and girls with disabilities face. I'll stop there.
Wonderful. Thank you, Marika. And I can already hear some echoes of themes that we're hearing across the different experiences and treaty bodies and things like that. So thank you for bringing the Global Disability Summit into this. And last, but definitely not least, Bonnie Brayton, may I turn it over to you?
Thank you, Deborah, and thank you to all the other panelists, of course. Shout out to Ruth. Thank you, Marika, for mentioning Ruth. I was going to say I was with her in New York, so I'm not surprised she made a big splash over in Berlin as well. So, shadow reports, Geneva, and outcomes. You've heard from Neil on the incredible work that the Civil Society Network has been doing since March of 2025. Dawn Canada was very pleased to be able to send our Director of Indigenous Initiatives and one of our human rights officers to Geneva for Canada's appearance before the CEDAW Committee in the fall of 2024. And I know that the Dawn Canada's report and the link to the report are being provided to everybody today. And of course, a deeper dive, but I did want to give some highlights from that because I do think, like I said, when we want to talk about, again, from Deborah's question, right, international level, what activities, so the two that I'm going to talk about in this question are going to be Canada's appearance before the CEDAW Committee and briefly on my good fortune to be able to go to Beijing Plus 30 in New York in March. So that document, again, was developed by Dawn Canada in partnership with Indigenous Disability Canada. Evelyn Hutchins, who's our Director of Indigenous Initiatives, is on a cross appointment from Indigenous Disability Canada. So again, really for people to think about how you go about doing this work, you have to be innovative and you have to think beyond your own practice. I really liked what Marika said about how, the work has to be done across movements. And I think the work that Dawn Canada and IDC does is a very good example of that. So in terms of what the report covers, of course, it's talking very strongly about Canada's obligations. In terms of key areas, I think some of the things that we wanted to see addressed was the overrepresentation of Indigenous women in federal incarceration, barriers to education, employment, housing, and services, implementation and recommendations from the Missing and Murdered Women's Inquiry. And in terms of, like I said, some of the things that just to highlight from that report, in terms of incarceration, Indigenous women account for 50% of federally incarcerated women and face systemic barriers, including high rates of victimization and disability. Women with disabilities and healthcare, and of course, we've had some discussion and touched on MAID Track 2, which again was an important part of the report and an important part of what we were looking to address with respect to the Government of Canada. And specifically in terms of the Missing and Murdered Women's Inquiry, that only 2 of the 231 calls for justice under the Missing Murdered Women's Inquiry had been implemented. And of course, where we sit still in the context of the report is with women with disabilities living with the highest rates of gender-based violence. And we put a great deal of emphasis on that in the report and the impact of COVID-19 on women with disabilities who were disproportionately affected by COVID-19, facing higher rates of infection, mortality, and violence during the shelter-in-place policies. And what I will say, and I think is really something that I got very strongly from both of our representatives, Evelyn and Barrow, which was that the CEDA committee were openly chastising the Government of Canada representatives during this process because they were coming again without responses and really without substantial responses to the questions being asked by the committee and by civil society. I think the other thing that I was asked to speak a little bit about, and I was going to say there's a report that can be circulated to participants later, which is a report on the Beijing Plus 30 delegation from Canada, which I was delighted to be a part of, to the UN in New York in March. And again, because Dawn's reported extensively on experiences with CEDA, I think it would be important to say that, of course, this was no different from previous ones where there was very little in the way of presence of women and girls with disabilities. A few really excellent side events, including one that was hosted by HI, that included Ruth, the same Ruth that Marika mentioned before. And I was going to say at the same time, we did what we always do, which is we made sure that we started to organize almost as soon as any of us were on the ground and had a number of sort of quickly put together meetings, including one on the last day in the cafeteria of the UN, because again, the ability to organize at the UN is really challenging. And I want to say, you know, to be again at the UN this time and to again see ourselves having to do this was, I think, sort of echoes what we're really hearing in terms of the formal and informal reporting from civil society. I would say that the one thing that I want to talk about, because I think it ties back into some of the things we're trying to get at here in terms of this policy discussion, is that the most exciting experience that I had and that we saw at Beijing Plus 30 was the incredible, powerful, and very positive presence that Indigenous women from around the world made. There were a couple of events, including 2 that we went to, where again, the other thing that I found really amazing was the fact that there were Indigenous women with disabilities participating. For example, there was a wonderful young woman from Women with Disabilities Australia at another event that I was at. We met later and didn't know the connection until we were in a separate space talking about Dawn and Women with Disabilities and Women with Disabilities Australia, sorry. But it's just to say that the presence of women with disabilities at this event, I think echoes what was already clearly made in the original sort of, what's the word I'm looking for? The original recommendations in terms of increasing the presence of women with disabilities, going all the way back to the original Beijing meetings. To see us at Beijing Plus 30 still struggling for a presence speaks to the fact that we're still at a point where we're underrepresented. And again, coming back to all the concluding observations, in this context, what are 2 policy recommendations? So I have here, Deborah, policy reform targeting targeted spending, and a meaningful use of disaggregated data to address intersectional inequalities, an ethical review of the expansion of MAID, and respect for the treaties that the government has signed, because of course, these are in contravention of our treaties. All of Neil's recommendations. Resources for the mission work is, I think, something that Dawn is beginning to start to focus on in our conversations with the government, both here in a Canadian context and in a global context. I don't know if I haven't seen Leah's hand up yet. No, I haven't. I have. It's time. Oh, okay. I'm sorry I missed it. Okay, sorry, I'll stop there, Deborah. Thank you.
Great. Thank you, Bonnie. So before we move on to the specific questions, I just wanted to highlight a couple of themes I heard across the people, because I think there was just so much information and so many interesting recommendations. What I heard people say was the importance of measuring measurable change, from Maureen at the beginning through each person to Bonnie at the end, talking about the importance of data, really having a sense that we need to be able to monitor and measure that change. And sometimes that takes organizational work, and sometimes that takes data. We need to recognize the diversity of people with disabilities, especially women with disabilities, and that they have different experiences, especially of poverty and gender-based violence. We need governments to recognize and support the leadership of women with disabilities and support the organizations who work with them. And we want governments to engage meaningfully in the treaty bodies that they've made commitments to. But those are some of my summaries. What I'd like to do now is shift to part 2 of our conversation, and these are individual questions for each individual person. And I'd like to start with Neil. Neil, you've talked a bit about some of the setbacks and barriers for women and girls with disabilities in Canada. Why do you keep working at the international level, and what can come from that work?
Thanks, Deborah. Yeah, it's a good question, and I guess that's a question for any civil society organization, and even provincial and federal governments. When you think about it, there's a lot of good people trying to do a lot of good work, which often doesn't translate to change within Canada. We live in a world where disability, the discrimination against women and girls with disabilities is fairly significant. And this isn't something that happened last month. This has been going on since recorded history. And we think as a world, we should have moved a lot forward, and there has been some forward movement, but not to the level that anyways, in my opinion, I think that we would ever imagine that we should be at. And we looked, like I said before, we looked at the changing dynamics in the world today with kind of the me first attitude as gripped some governments, and influencing our wellness in Canada. It's something that I've never seen before at that type of level, online or in the news, wherever it might be. So in Canada, of course, as you said, Deborah, we just had a new election. We're looking for good things from the new government, whether that coalition is going to do. It's important to notice or to note that in this election, the MPs and political people that were predominantly supportive of persons with disabilities either didn't run or were elected out. So from civil society's perspective here and in Canadian disability community, we now have to find new people that will step forward and advocate and be the champions within the federal government to really push the disability agenda for all people with disabilities, women and girls, particularly because they're one of the most impacted groups. And that takes time, right? And it takes effort, and it takes a will. And unfortunately, often in government, there isn't that will. There's other priorities that seem to be, put forth that take precedence. It gets deferred to the province and territories. There's so many other things that governments are dealing with, or so they say. So things that are accomplished are often easy things to get done. There's not a lot of money put in or a lot of effort put in to make sure that there's positive change coming forward. And again, at the UN level, if they are going to delay reviews of conventions 8 to 12 years. The pressure that we got from the UN, realistically, because, the conventions are not binding, the pressure we got are kind of international pressure and embarrassment to the country by the UN to address these areas of deficit to go forward. And now we're moving to an 8-12-year cycle. That pressure, we're losing that too. So not only have we lost the advocates in government that we've traditionally seen over the last few years, we may lose the pressure from the international community as well. Hopefully that won't be the case. But why do we keep doing it? Because if we don't, we know nothing will happen. We have seen some change, to be sure, not as significant as we would like them to be, of course, and we just keep pushing forward. I mean, our organization was always a direct service provider. We were never ever envisioned ourselves to be, really moving into human rights work at the international level or in Canada itself. We're a direct service provider. Most of the programs we do are one-to-one services. But when we saw the deficiencies, and more so in the last years when it came to medical assistance in dying as well, and how that has really impacted persons with disabilities and really targeted them, when we're dealing in a country that, poverty for persons with disabilities rampant, lack of affordable housing, employment opportunities are limited because of discrimination and factors such as that. If we're not doing it, if the people in this room is not doing it, if the supporters in government who are on this call right now aren't pushing for what they can to make those in charge make the change, then we won't see any forward movement. So while we all may get frustrated and we all may have some sort of defeats in our careers, I think it's important that we continue at the international level. And we want to be at the international level when we're highlighting Canada for the great work that it's done. And we've been there before where things have been done that were significant. We need to get back there. And that means that we need to have governments, provincial, federally, territorial, step up and say, look at persons with disabilities, women and girls with disabilities are an asset. They're not a liability. And we need to foster their growth in Canada and have them take their place as leaders. That's politically, in organizations, and elsewhere. And we can't do that by doing nothing. And because I guarantee you, if we do nothing, we'll get nothing, right? So we have to take that risk to go forward and take the chance of failure and frustration, but it's a chance we all have to take. Thank you.
Wonderful. Thank you. I'm more optimistic than I anticipated, so I'm grateful.
Well, wait a second. Let me say a few bad things.
No.
Anyway.
It's all good. So maybe we can turn to Bonnie then and ask Bonnie. Neil is arguing that we need to be there. We need to make change. How have you used increased knowledge and data about the situations of women and girls with disabilities to press for change in Canadian and international contexts?
Thank you. Thanks, Deborah. So for sure, I mean, one of the things we know is that over and over again in the concluding observations, Canada is supposed to be supporting the leadership and capacity of women and girls with disabilities. They've been told that for as long as I've been, sitting at my desk. And, incrementally, because we fight and fight and fight, we see some resources come our way. But I think, what Neil has talked about, I think what all of us understand is that ableism is still a bridge too far for lots of people, including a lot of people in the human rights family, who still don't talk about ableism in the same way when they have conversations about intersectional practice. Well, Dawn Kennedy is sitting here, as far as I'm concerned, walking the walk in terms of intersectional practice. And I'm very proud of that and very proud of where we find ourselves coming up on our 40th year in service, because I think that's another really important point. Dawn Canada is coming up on 40 years in service. We're the oldest organization for women and girls with disabilities in the world, and pretty much the only party still going on in Canada. Lots of good movement in that respect, but that's where we are. We're still underfunded and still not being properly recognized. I think one of the things that really frustrates me is Dawn Canada was part of the National Action Plan planning. Dawn Canada's done a lot of really important work around gender-based violence, and not one single province or territory named women and girls with disabilities as a priority in the first year of their funding on the National Action Plan. That is the kind of thing that has to stop. This ableist attitude that we have is so clearly an important part of how we have to move forward. So I would say again to many people on this call who may not know this, I made a reference to mission work, and many people may not know, but Dawn Canada's been involved in dozens of Supreme Court interventions over the years. We work with Crown attorneys on something called community victim impact statements, the reports to Senate, the reports to Parliament, all of the work that we do, most of which is our mission work, is not funded. We have to do projects that line up with what the government says is important. And like I said, and we're still sitting here, and now let's talk about that number, Deborah, 30%. I've never had a bigger stick in terms of that statistic from Statistics Canada. And I would say a year and a bit into the impact, it's starting to show up because policy people cannot ignore 1/3 of women in this country and keep sort of footnoting us, if you will, as we famously have said has happened here at Dawn Canada. So Dawn Canada has 4 pillars for people who are not familiar with our work: research, education, policy, and advocacy. Some of the work we do, wonderful research we do, is in fact with Professor Steenstra at the Live Work Well Center in terms of both domestically and with the EDID project and with Leah and some of the other folks. In terms of I think a good example of work that Dawn's doing in Canada, the Accessibility Standards Canada have contracted Dawn, and we're working on the standards for prisons, for women in prisons, and partnered with the Canadian Association of Elizabeth Fry Societies in that regard. And the collaborative research pieces, again, the ones that go across the sectors, of course, are a really important way we're going to change that landscape. Education in terms of doing workshops and training and practice, these sorts of things in terms of showing people, telling people, GBA plus, intersectionality, what's the difference? What can you take from that? How should you be applying it? Trying to get more women's organizations to include women with disabilities in their work, not just in theory, but in practice, and finally, I think beginning to see real uptake, and I think I attribute some of that to the CRPD work and MAID, is what we've seen is a real shift in the disability community around intersectional practice. I can tell from the way you're nodding, I must be out of time. Am I?
You are. Thank you, Bonnie. I hope somebody raises some important questions, but we've put a link to Dawn's website so they can see more of your good work in the chat. Thank you.
Red. I don't know what's going on.
Marika, maybe we can shift from a somewhat more domestic focus to the international focus. What do you think, and what does HI think, are some concrete actions that can be taken to include both gender and disability in Canada's international development assistance programs?
Thank you, Bonnie. That's a good question. So one of the commitments that Canada already submitted in 2022, but where we have yet to see much progress really, is participation of persons with disabilities and their organizations in the development, in the review, and the implementation of Canada's international development and humanitarian assistance policies. And that's really, when we talk about the principle of nothing about us without us, that's what that's all about. And I should mention, this was again also emphasized by the CRPD committee in their most recent review this year. And of course, this participation is for organizations here in Canada, but also organizations in low and middle income countries. And I also want to note that there should be specific focus on women and girls with disabilities and their organizations, because OPDs are not necessarily inclusive of women and girls with disabilities. So that's important to keep in mind. And so one way to ensure that participation is by having these accessible participation and feedback mechanisms in place, but also budgeting for reasonable accommodation, which is really important. Secondly, I think what's very important is really that gender and disability require more than a checkbox exercise. We see this very often, that disability, for example, is listed with a long list of other at-risk groups, but that's really insufficient to really have an impact. And just to give an example as well, in 2023, Canada's Feminist International Assistance Policy was reviewed by the Auditor General, who noted that really the department's gender equality assessment process for projects, it did not consistently include analysis of intersecting factors other than age. So really these intersectional frameworks have to be applied effectively and efficiently throughout all programs and projects, and specifically considering barriers faced by women and girls with disabilities. In addition to mainstreaming gender and disability, I also just want to flag that we also need specific funding for projects and programs that target the topic of gender and disability in that intersection, and women and girls with disabilities specifically, so not just through mainstreaming. And to really promote and invest in leadership of women and girls with disabilities, we also need long-term sustainable funding for these women-led organizations, which means going beyond just project-based support, which is really an issue. And so for us, for instance, Humanity and Inclusion, we work with women-led OPDs, but what's important is that eventually these organizations can also directly access funding. And so that requires taking it into account and tackling some of the barriers that they face in accessing funding. And this means that processes and information has to be completely accessible, that there has to be sustainable core funding, that funding should also be available for organizations of women and girls with disabilities that are not registered, because in many countries, because of restrictions on legal capacity, for example, they are not able to be formally registered. So that's a very important barrier to tackle as well. And we've talked about targets. I think there's going to be some repetition here, but I think some of the recommendations merit repetition. So we talked about targets and being measurable. And so I think for the Canadian government to continue consistently using gender and disability markers is very important to track gender and disability inclusive funding. And also to continue investing in capacity building of their own employees when it comes to disability inclusion and intersectionality. We've mentioned data several times, but I'll mention it once again because it is really important and there are still really significant data gaps. And finally, as Bonnie had mentioned as well, just really upholding those rights commitment and ensuring that all policies align with Canada's commitments under the CRPD Convention, the CEDAW Convention, and all other human rights commitments. I'll stop there.
Wonderful. And I'll find my unmute button. Thank you for that really substantive list of possible actions that can be taken. I'd like to close off this section with a question with Maureen. Maureen, reflecting from your vantage point, how do you think civil society, not just governments, but how should civil society themselves organize itself to hold federal government accountable on its international commitments related to disability and work, or disability more generally, specifically related to women and girls with disabilities?
Such a good question. Thanks so much, Deborah. So when I was asked this question, I immediately thought of Tuckman, right? It's form, storm, norm, and perform. And so I would say that we have to follow that for sure. It's reading and knowing the charters, the proclamations, the agreements that Canada has made, and understanding also how Canada has interpreted those commitments, because civil society might think one thing, but the government is thinking a different way. And then I think it's right around the forming part, it's finding your people and finding all of the people who are like-minded and the people who are not like-minded, and forming that and from a variety of sectors and backgrounds that you don't normally think about too. And I'm going to get to that in a second as well. But so, for example, at Disability and Working Canada, which is an initiative in itself, we are based in lived experience that intersects with research, academia, service providers, all levels of government, and specifically policymakers. And so we have to find these people and we have to understand their perspectives on the information and how Canada is interpreting the information. And then in that formation, we also have to understand who's missing from this group, and how are women and girls centered in the discussion. That storming area is up to interpretation. I think that storming doesn't have to be as violent as it sounds. I think it can be organic. I think it can be gentle. But I think that, so for example, again, at DWC, we storm by gathering and sharing knowledge. And then we norm all of that by agreeing to our next step as a community of rights holders. But I think that performing is really where we need to spend and focus our time. Now that we're all aware and that we all know what we want, how do we do that, right? And who does what? And again, who needs to be engaged? And we also, I think, something that's, I think, very, very important is we need to foster a relationship with the federal government. As CSO and disability organizations, we need to foster who the champions are within the federal government. We need to find who is supporting us going forward, who are our allies. And I know that Neil's point about making like new inroads with the new government, absolutely. Like we need to do that now. It's a great opportunity because we have some formation already happened from all of these like we're aware of all of these agreements. And so we've already got that formation, and it's just a matter of kind of shifting it a little bit and making sure that the government understands it, right? Having how and making sure that in that shift that women are leading, and that there is a feminist understanding of the work that is being done. So and making sure that we're not preaching to the choir. Oh my gosh, like we have to stop preaching to the choir. We all know. I can't tell you how many times I walk into a conference, and the starting point is, do we all think that people with disabilities have value in employment? And I just think, how are we not elevating the conversation from that already? Like we need to build on the conversations. I see that today on the call, Global Affairs is here, and that's critical. Because the government needs to know that we want to see the changes, and we have to understand that the government wants to see these changes. We're not fighting against each other. We are joining, right? And so we have to recognize that while we have to make a relationship with the new government, we also have to recognize, and Bonnie has said this 10 million zillion trillion times, that there are lots of public service employees who have been around, who know the system, and who are our friends. And we need to keep them close and arm them with the information that we know, and allow them to arm us with the information that they know. We've already talked a lot about measurement, but I will say that one thing that CCRW has done is we have started building measurement into our funding requests. So we make sure that everything that we are doing is measured. Most of the things, I heard this on the CBC the other day, most of the things that are important in life cannot be measured. But our logical brains need it to be measured. So let's measure it for those logical brains that hold the money pots, right? And make sure that we are actually applying for that funding in the first place. And so, okay, I'm almost, do I have 1 more minute? Is that mean 1 more minute?
That meant time, but you can have 30 more seconds.
30 seconds. Okay. So, okay, just a real life experience. Bonnie's already talked about, Indigenous Disability Canada and Dawn coming together. But I also think that we need to think about that. What are our superpowers, right? Where are the areas that we influence the most? And then we have to bring others in. So I sit on the board for Accessibility Standards Canada. They're doing an intersectional approach to decision making. That's what they are going to do. Their bylaws are going to read that. They've also for their technical committees, for example, their technical committees in standard development are being measured for their intersectional representation on those technical committees. That wasn't an accident, that was on purpose. So find those opportunities. And that's all I have to say. Thanks for giving me 30 seconds extra.
Wonderful. Thank you, Maureen. And thanks for those really concrete responsibilities, I think, of civil societies to learn more, to figure out, to gather together, to agree to common actions, and to foster relationships in order to build that change, both relationships together, but also relationships with those on the inside. So thank you. And so I really want to thank all the panelists and all those who participated for thoughtful interventions and comments and questions. I think we've been able to have what I think is a valuable discussion about priority areas for action from Canada's international agreements, but also the leadership of women, girls, and gender diverse people with disabilities to address those areas. And as Ravimbo said, we've given, the message is incredibly clear. It's consistent, it's universal, data, involve women and girls with disabilities representative and other organizations, fund their participation, make sure that you mainstream disability, but you also have targeted projects related to women and girls with disabilities. So thank you to our panelists for sharing their knowledge and experience. There have been a number of people working behind the scenes that you haven't seen to make this event and all this series happen. And I'd like to thank them, first and foremost, Leah, as I say, my co-conspirator on this one, Lenore Lara, who's the queen of organization, Jordan Craig, our inveterate chat person, Benedicta Hughes, Carrie Shimon, Vanessa Bonham, Catherine Hall, and our captioner, Christy Purnell. As I said, this is a series, and while we're done for the season, we will pick up again in the fall. And we're going to be working with a panel around accessibility at the municipal level. So we're going to go from the international back down to the municipal. If you'd like more information about this panel, we'll be posting the recording when it all gets ready to be posted, but information on the future pieces, contact the Live Work Well Research Center, our news and events, and we've put a link in the chat for you to join our membership if you'd like. Again, thank you everybody for what I think was a really powerful and really insightful gathering, and I hope you have a great rest of your day. Thank you.